the control buttons disappear for me, but I really appreciate you all participating today with our double entendre of TikTok for Teens. We welcome all outdoor enthusiasts and those who want to be able to access the outdoors safely without fear of creepy critters crawling into their clothes and onto their body. A quick mention of what Teens to Trails is. We work across the state of Maine to help connect high school students with the outdoors. And the primary way that we do that is by helping schools to establish and then support outing clubs as an extracurricular activity that's super fun. We are all about play. And in the days before COVID and our physical distancing, I used to summarize what we do by play together outdoors. Those 3 words. And some of the ways that we do that are by sharing our expertise with the clubs, by offering grants. We can give grants for up to $500 to clubs to apply for those in the fall. We offer core programs to teach skills and bring outing club students from around the state together for building friendships and being outside and playing. And then we also do gear drives and distribute gear to clubs so that they have the equipment they need to safely access the outdoors. We connect them with professional guides. And who doesn't want to learn things like how to clean a fish or build a snow shelter?
Could you put on a timer?
That's the summary.
Actually, that's good. Start it up.
That we do. And from there, I want to turn it back to Jean for an overview of our time together today. Thank you.
Great. Excellent. Thanks so much, Alicia. So today we're just really happy to have Molly Meagher and Chuck. Now the Lubelczyk, got it right, Chuck? Yeah.
Yes.
And myself. And so rather than, I'm going to ask Molly to just introduce herself and tell us why she likes ticks so much and how comfortable she is in the outdoors with that knowledge and doing things. And I asked Chuck the same question as well. So Molly.
Yeah, of course. I actually don't have a huge background in ticks. A job opportunity just kind of presented itself to me, and I didn't know much about them. But once I started learning, it all kind of clicked, and I really, really enjoy them. And I have no fear going outside. I wear my proper tick protection, and I always do tick checks when I come in, and I almost never have any ticks attached or crawling on me. So far, so good.
Jack.
Yeah, and so my background is actually as a wildlife biologist, and so with our work, a lot of the work that I do, along with Molly, is that we do a lot of work surveying wildlife for ticks and mosquito-borne diseases. So we get to go out and work with live animals such as skunks, raccoons, possibly white-tailed deer or moose, and migratory songbirds. And I also have no worries about going out in the field from ticks or mosquitoes, but like Molly, I do dress appropriately. And I also am an avid dog hiker and walker and runner. And my dogs are with me a lot in the field, and I also am not worried about them because we do take precautions.
And I'm not there on the right. I'm Jean Christie, and I am a tick magnet. And I have dressed to mirror how not to dress in the outdoors. You'll see in my picture. So I have sandals on. I have got some dark colors that will camouflage the ticks well. My shorts and loose top provide multiple areas of entry for the ticks. And I have a very shaggy dog who can hide large numbers of ticks in her fur as she goes in and out of the house. So that picture of me is an example of what not to do. So we'll talk about how to dress, but I am a walking, talking example of how not to dress right here. So next slide, please.
So Chuck, do you want to do a little introduction here?
Yeah, sure. So this talk is going to be on tips for all of you that like to go outside, as well as tips that you can also apply to your family, as well as your pets. And we include pets a lot because they are our companions a lot outside. and they get exposed to ticks as much or more than we do on a regular basis. We hope that you'll be able to come away with this with quite a bit of info, and hopefully will reduce your tick exposure in the upcoming tick season.
So I'll go ahead and get going here. I already saw some questions in the chat, so that's pretty awesome. In Maine, we have up to 15 species of ticks. We tend to focus on our deer tick and our American dog tick. Our deer tick is the greatest cause for public health concern, while our dog tick is in high abundance. Both of these we pay particular attention to. Here we see the female deer tick, the male deer tick, female dog tick, and the male dog tick. In this next slide, we can see the different life stages of our deer ticks and dog ticks, and we also see some engorgement levels. These are female deer ticks, and this is a female dog tick. This is a deer tick nymph. This is a deer tick male and a deer tick female, and this is a deer tick male, or a dog tick male, and a dog tick female. And in this next slide, I can show you guys just how small ticks can be. So there's some ticks hidden in this muffin. I don't know if you guys can spot them, but so these are our deer tick nymphs. We have a couple rules of thumb. Our deer tick nymphs are going to be about the size of a poppy seed. Our deer tick adults are going to be about the size of an apple seed. And our dog tick adults are going to be about the size of a watermelon seed. So here again, we see our photos of our deer ticks and our dog ticks. Just a quick tip for identification, our dog ticks tend to have white markings on them. And so if you need to distinguish, that's a quick way to do it. We see our deer tick activity in the early spring to late fall with a peak in May and October. Our deer ticks have the potential to carry quite a few disease-causing germs, and that's why they are our largest public health concern. Our dog tick are not known to spread diseases in Maine, but we are keeping an eye out for that for sure. And it's still, you need to be pulling these ticks off as you find them, no matter what species they are, of course. And here is an example of deer tick habitat. They have, or they like to have, a leafy canopy up top, and their understory, they like to have some shrubs along the side and maybe some leaf litter down here. This may look a lot like some of the trails that we all love to walk on. That's why it's particularly important to kind of stay in the middle of the trail as much as possible and not be rubbing against these shrubs and edge here. And just a common misconception is our ticks aren't going to be wearing villain capes and flying down from the leafy canopy up here. They do not jump, they do not fly. They're going to be along this shrub and leaf litter area. And here's just our deer tick life cycle. They are born as, of course, eggs and hatch into baby ticks or larvae. They have a blood meal and then morph into our nymphs, which take another blood meal and go into or become adults. It's important to stress here that our nymphs and adults can bite humans. So as I showed you, these ticks right here can be tiny, and they're the greatest risk for human Lyme cases, while these adult females are the greatest risk for canine Lyme cases, and maybe we can talk about that more a little later. So when do people encounter deer ticks? The greatest, I think I kind of mentioned this earlier, for adults, your greatest month is going to be May and October, while for nymphs, your greatest months are going to be June and July. So that kind of stresses that from spring all the way through fall, you're going to want to be out on the lookout for these guys. So about a tick bite, the ticks have a beak, which is kind of similar to a fish hook in the way that they have these barbs that are kind of reversed. So that can make it tricky to remove the tick once they've bitten you. And they use this kind of anesthesia, similar to, say, if you're having some dentist work done. And so that's why doing frequent tick checks is really important, because you may not feel them biting. And here, just quickly going over where Lyme disease is in the US. It's primarily in the Northeast, of course, and it's kind of spreading over to the Midwest here. Here, Massachusetts does not count individual Lyme cases. They're not special. I think we all know that by now. In this next slide, we see June and July are the highest months for incidence of Lyme disease. And we like to relate that to, this is when people are out hiking, biking, walking with their dogs, and they're also trying to escape the Maine humidity by wearing shorts and sandals and things like that. So, and just some Lyme disease symptoms. I was brought to my attention that some of these are kind of similar to COVID symptoms. Fortunately, or kind of unfortunately, about 50% of Lyme disease cases have a bullseye rash, which I don't think we're going to be seeing with COVID. And here are some examples of our bullseye rash, and these can kind of vary depending on where in the body the tick bite occurred, and also the individual. At this point, I think I'm going to just pass it off to Chuck.
Okay, and so one of the things that we do have with ticks in Maine, and along with a lot of the other northeastern states, is we don't just have one disease that these ticks transmit to people or pets. We actually have a few of them, and I'm going to go a couple of slides, talk at least about a couple of other diseases we have. The first one is called anaplasmosis. It is common in the southern part of the state, but is seen almost statewide. It has similar symptoms to Lyme disease, with the exception of the bullseye rash. It does not have the rash, but is very treatable with antibiotics, as is Lyme disease if caught early. Next slide. And like Lyme disease, the number of cases of anaplasmosis reported to the state go up every year. And you can see on the right that there is a pretty wide distribution of anaplasmosis occurring in people in Maine. We've seen a recent upsurge in it, or uptick if you want, in the mid-coast areas, as well as areas going over to Augusta and the western boundary on New Hampshire. But we do see it increasing almost every year. Next slide. The third most common disease is called babesiosis, and this is also transmitted by the deer tick. This is a little bit different in that it is very mild in most individuals that contract it. However, in people that are immunocompromised or have issues with their spleens, or possibly are having an issue with a blood transfusion, may acquire babesiosis, and it can be severe. It is, however, also treatable with antibiotics. And next slide. Does occur in far lower numbers in Maine than either anaplasmosis or Lyme disease. And similarly, it has a much more discrete and concentrated distribution, really with the hotspot being the southwestern corner of the state, primarily York and Cumberland counties, with a small little outcrop in the mid-coast being seen in the last couple of years. But historically, this has really been restricted to areas like Kennebunk, Wells, Kittery, Scarborough, Portland, Brunswick, and it's only in the last couple of years that it's really being seen outside of that in other parts of the state. Next slide. So when you're outside, however, there is different risk depending on what you're doing. And some work being done in Connecticut has really found that the biggest factor in acquiring ticks or tick-borne disease tends to be associated with areas around the home. So you can see from this graph that playing outside, doing things like yard work and other things around the home tend to be more associated with finding ticks on yourself or your pets than doing things like hiking or camping. So those of you that want to get out of doing yard work around your home, you can tell your parents that you don't want to get ticks, and so you should just go hiking instead, probably. Generally, I think that what happens is that when we're out hiking, camping, or walking the dog, we're actually thinking about ticks more than if we're out in our backyards. And I think people tend to be a little bit more vigilant and a little more detailed in doing tick checks on themselves and their animals when they come in from a hike or a walk, as opposed to just going out in the yard for 20 minutes or a half hour, hanging out, coming back inside. You really don't think to check yourself as thoroughly. But in areas where ticks occur, you do need to be vigilant and you do need to check because obviously, very short activity outside can still result in a possible tick bite. Next slide. And so if you're out though, as Molly mentioned earlier, there are going to be areas that are going to be hotter for getting ticks than others. And this is just a slide showing the areas that probably have the most risk if you're walking down your average wide trail. You can see where the blue lines are going to be the areas where most of the ticks are going to be encountered in higher numbers. These are areas pretty close to the shrub or wood line. And in general, the middle of the trail, especially if it's a wider trail, is going to have far fewer ticks. This is because there's going to be more sunlight and generally a lot more wind in the middle of the trail, which is going to dry conditions out, which the ticks don't like. However, if you have dogs like my two dogs, and they are bad dogs sometimes, they like to go off trail or go to the side of the trail and run along and smell everything they can find or perhaps roll in it. This means that they are possibly going to encounter ticks more often. And so certainly if you're taking your dog for a walk and they are hanging around the edge of the trail as you're walking, be aware that you really should give them a good thorough checking over when you come in from being outside. Next slide. And so tick bites, the first line of defense is always going to be the clothing. Unlike mosquitoes, ticks cannot bite through fabric. So even the thinnest of fabrics, even during hot weather, the thinnest of fabrics are going to protect you from a tick bite. Lighter colored fabric is good because ticks don't show up on dark colored fabric, but you can see them better on lighter fabric. And then using a repellent, either one that goes directly on the skin or on your clothing, will also help to reduce tick bites and get the ticks off of you. And then finally, doing a lot of work around your home, because the home is going to be your biggest area of exposure. Doing work around the house, like keeping your leaves raked, keeping the shrubs away from your lawn as much, and then doing your daily tick checks on you and your pets are going to be very important, especially if you live in an area with a lot of ticks. Next slide. And so a couple other additional things you can do. On the top left, there's a photo of someone's foot, a sock, and a pair of pants. Most ticks are going to bump into people around the ankle level. And so covering up the cuff of your pant with either a sock or a pair of high boots is actually going to be one of the best things you can do to actually reduce ticks from getting in under your skin and attaching. Similarly, you can also give your pets, either dogs and cats, a monthly tick treatment. It can be either oral or what they call a top spot, which is the photo here, applying a small liquid to the back of the neck of your dog once a month will actually help to either kill the ticks or repel them from your animal's fur. And then on the bottom left, we see a variety of repellents that you can buy in almost any store, such as a big box store or a hardware store or an outdoor supply place. And they are readily available and are pretty affordable as well. Next slide. When ticks actually eventually get around to biting you, they actually have areas on the body that they actually prefer over others. They like areas that are dark, areas that are sheltered and not being rubbed with fabric, and areas that are warm. So that means for us, around your hair and your hairline, the back of the ears, in your armpits, your navel, areas around the waist, the back of the knee, not the front, because the front of the knee will frequently get rubbed by fabric, and then between the legs are all areas that ticks will eventually settle into and start feeding. So they're important to check. On the left, on your pets, and although the dog is shown, this can also apply to cats as well, areas around the ears, the snout, and the eyes, where whiskers are. Areas underneath the collar is a sheltered spot that's pretty warm and dark for ticks to settle in. And then again, behind the legs and areas around the tail. And the tail frequently is hard to get to and groom on animals, so they have difficulty getting to it. And so the ticks can settle in there and not be all that disturbed if they get on your pet. Next slide. Now, there's a lot of information out there about how to remove ticks, and about 90% of it is not great information. There is a lot of information saying that you should smother the tick with things like nail polish, petroleum jelly, or even peanut butter. That doesn't really work. There's also a bunch of people who like to use things like fire and matches and burning the tick, which could be fun, but generally doesn't work all that great. The one thing you don't want to do is upset the tick. Upsetting ticks tend to do things like regurgitate stuff back under your skin, and burning them or trying to apply alcohol or petroleum jelly or nail polish will upset the tick a lot. And so you don't want them to regurgitate back into you the blood that they are sucking out of you. Usually you can use a fine pair of tweezers or a tick removal tool that you can get from doctor's offices, veterinarians, or outdoor supply places. These all work really well to get the tick off using a gentle, patient tugging to eventually remove the tick so the beak and the head of the tick come out with some persistent effort. Next slide. If you happen to find a tick on yourself and you want to have it identified, there is a place in Maine at the University of Maine in Orono where they will identify a tick for free for Maine residents. They ask that the tick be placed in a waterproof and crush-proof container with alcohol to prevent the tick from breaking up during mailing. If you happen to come in from the field and you want to check your clothing, the best thing to do immediately to kill the ticks is to throw them in your dryer on a high heat cycle for about 30 minutes or so. Regular washing will not kill ticks unless you apply chlorine bleach to the wash, but putting in a high heat cycle of drying for about a half hour will kill the ticks off. You can then throw them in the washing machine afterwards to kind of flush them off your clothing, and that actually works pretty effectively to do in the ticks. Next slide. For submitting ticks to the University of Maine, this is their website that you can go and download a form to fill out. Ticks will be identified free of charge for Maine residents, and they do offer for a minimal fee testing for different pathogens as well. So you can get Lyme disease, babesiosis, and anaplasmosis in your ticks tested for, and they will get the reports back to you fairly quickly, usually within a week or so. Given busy times of the year, you may have a little bit of a slower turnaround, but they generally are pretty fast about that. And again, all that information is on their website at the University of Maine Cooperative Extension. Next slide. For more information, we have a bunch of different agencies, including our Maine Health Department. The Maine Center for Disease Control has a bunch of different information and fact sheets, some of which Jean has already placed on the webinar website. But then our lab at the Maine Medical Center Research Institute in Scarborough, as well as the University of Maine Cooperative Extension in Orono, will also be happy to answer any questions you might have about ticks and tick-borne disease.